Today's session is going to be focusing on face mask considerations for CMC in a school setting. Our presenters are going to be Dr. Dennis Kuo and Dr. Carol Weitzman. Dr. Dennis Kuo is a primary care pediatrician, associate professor of pediatrics at the University at Buffalo, Division of General Pediatrics, and interim chief of developmental pediatrics and rehabilitation of UBMD Pediatrics Oshai Children's Hospital. His academic work has focused on family-centered care and family-identified health care needs of children with disabilities and medical complexity, early childhood care coordination design, and healthcare system reform. Dr. Kuo is a chair of the American Academy of Pediatrics Council on Children with Disabilities. Dr. Carol Weitzman is a developmental behavioral pediatrician and the co-director of the Autism Spectrum Center at Boston Children's Hospital and the director of Connecticut Center for Developmental Pediatrics. She is a current president of the Society for Developmental and Behavioral Pediatrics and the immediate past chair of the American Academy of Pediatrics section of Developmental Behavioral Pediatrics. She is the author of the AAP interim guidance supporting the emotional and behavioral health care needs of children, adolescents, and families during the COVID-19 pandemic. Dr. Kuo and Dr. Weitzman, I'm going to turn over to you. Thank you.
Hi, everybody. Good morning. It's Dennis Kuo. Great to see everybody here. We're going to be talking about face mask considerations for children with medical complexity in the school setting. I'll let Dr. Weitzman say hi.
Good morning. I'm delighted to be here. Whenever someone has to introduce me and say developmental behavioral pediatrics like more than once, it's like such a tongue twister, isn't it? Thank you all.
So we'll discuss really a lot of considerations. At this point, many, if not all of our children have been invited back to school. There's probably some exceptions still left throughout the country. But this pandemic obviously is not over as cases go up and down. Our hope is to give folks that consideration about the issues necessary to engage in shared decision-making with providers and educators to be able to move forward. Next slide. Neither Dr. Weitzman nor I have any relevant financial relationships with commercial products that are relevant to the discussion. I will disclose, as with AAP presentations, that my spouse does have a commercial relationship with, she provides design services for a company that makes joint replacements, and that's not something that's relevant to this particular presentation. Next slide. Our objectives this morning are to discuss the importance of face masks as part of safety in the school setting for children with medical complexity, review the strategies to support face mask use for children with medical complexity, and to understand how to support shared decision-making in weighing options for school attendance and face mask use for children with medical complexity. Next slide. Face masks are a key element of protecting against COVID. The CDC states very clearly that universal and correct use of masks should be required. The AAP strongly recommends universal use of face masks in schools for adults and for all children who are older than 2 years. It is important to note that the vast majority of children, even those with medical health conditions, are able to safely and effectively wear face masks with adequate practice and support, as well as modeling for adults. So our goal is to get as many children and adults to wear masks in the school setting as possible. There will be some challenges that we encounter, and we'll go through them throughout this presentation. Next slide. Schools, camps, daycares for children with medical complexity, they are just fundamental to providing academic instruction, support for psychosocial development, reliable nutrition in many cases, physical, occupational, speech, developmental therapy services, and they are a key set of services for addressing social and racial inequity that are also being laid bare, even barer by the pandemic. Next slide. Face masks are really an essential component. It's just really the bottom line. It is an essential component of COVID-19 mitigation strategies. But also important to recognize that it's just one component of what we call the Swiss cheese model, which is the approach of protecting ourselves against direct infection from COVID. The Swiss cheese model just means that there's multiple mitigation strategies. You have to do masking, there's distancing strategies, there's density strategies, there's cleaning protocols. So that means that every layer has the potential for failure. And if you have multiple layers, you will catch every single or as many failure points as possible so that the virus still doesn't get through. As this pandemic evolves, this will gain higher and higher importance as children are increasingly brought back to 5-day-a-week instruction throughout the entire school. Even if we have children that are already back 5 days a week, there will be even more and more children who may not have been invited back who will be increasingly brought back 5 days a week. That is going to change the density of the individuals in the school. That's going to change the workflow and the culture of masking and distancing in the schools. It is also of even higher importance as the variants continue to evolve. The landscape of the strains of COVID are different in May of 2021 compared to January of 2021 compared to September of 2020. And as the variants continue to evolve and circulate, we believe that there is changing infectivity and contagiousness with these strains, and that needs to be taken into account. And my guess is that everyone here has seen the changing epidemiology of who is infected with the increasing vaccinations, decreasing social distancing, and that children are increasingly affected as a proportion of individuals infected with COVID. Next slide. When we talk about protection in the school setting, and this actually applies to any congregate setting, the National Academy of Sciences, Engineering, and Medicine actually has a good schematic that's based on OSHA recommendations. This is actually a pyramid, or really an upside down pyramid. The most effective way to protect ourselves is to actually eliminate the infecting agent itself. So we talk about crushing the curve or the vaccine, because if the virus is not circulating, then there's no exposure risk. Next is distance learning, which is substitution. So you can substitute the exposure. Next in that layer is engineering control. So with the environment, let's say that you haven't eliminated and you're doing in-person learning, you should think about ventilation, barriers, although that's actually been called into question as well, density of the individuals in the room, and cleaning protocols. And then with administrative controls, you're looking at the way people behave. So you have to train in routines such as regular hand washing, how people physically walk around, including, say, following 3 to 6 feet apart and reducing large gatherings. At the very tip of this pyramid is PPE. In the scheme of things, it's actually the least effective in protecting compared to, say, eliminating the actual exposure threat. So we have to recognize that when we're talking about masks and face shields, we have to look at the context of what is around us, and that should help inform the shared decision making. You have to know what's going on with the other hierarchy of controls to be able to get to the right point of shared decision making. Next slide. Then with all of this, so let's say you've gone through your exposure risk, you've gone through community circulation, you've gone through, that there's good ventilation, that there's, good administrative controls, but you have a situation where the child may be hindered in being able to wear a mask. And your considerations maybe there is a severe respiratory component. Maybe the child is chronically on oxygen and you are concerned about any compromise. Maybe there is a craniofacial component, so that might be affecting a tight fitting of a mask. Maybe there is a behavioral component, which, for example, maybe that the child may just continually take the mask off. And there may be other considerations we haven't mentioned here, but there are various reasons where it may not be as straightforward as saying, here's a mask, put it on and wear it. So I'm going to turn it over to Dr. Weitzman to talk about what if you have a situation where the child may not be readily taking to a mask, as that is a component of getting a child into the school setting. Dr. Weitzman.
Thank you. So I'm not going to talk about if, where there is, some kind of structural or real medical reason. I'm really only going to talk about mostly in kids where there's either a behavioral component in I suppose in a neurotypical child, or kids with more developmental disabilities who have some resistance to this. And, I think we're pretty far into this. So I think people are going to have a lot to add to what we talk about today in what your experience over the last year has been. So I'm going to just sort of lay it out there. I think we have to start with the perspective that most children with neurodevelopmental disabilities can learn to wear and maintain wearing a mask. So I think we have to give credit that children can do this, that families can participate, and that we can do this. It's just that the path may need so much more reinforcement and be slower on the uptake. But when we don't do this, I'll start with this, is that I just think we really potentially, are limiting children's ability to get back into their communities and be full participants in life. So I think it's really important. So the first thing when we talk about how to help children master face mask wearing is we want to explain, use language that can be understood. That's not scary language. That's not punitive language, just why it is important. This can be augmented, and I'll show that on the next slides, but that you can use pictures. It doesn't have to, if someone has difficulty understanding language, use pictures. As I said, I'll show you something on a couple of slides later. And then for verbal kids, ask them, what have they seen? What do they know? What have they heard about mask wearing? If we can let kids sometimes put voice to the things that they have fear about or misconceptions, it's much easier then to help them solve that problem or, give them more accurate information. We want to model mask wearing. We can't expect kids to do it if we're not doing it ourselves. And we have to be careful if we're complaining about wearing our masks or talking about how uncomfortable it is, because kids will also kind of pick that up too. And then we have to find masks that will be the most comfortable and try to provide choices so that if kids do have sensitivities, that we give them some agency in being able to be participants in identifying which masks, which are efficacious, they can wear. Next slide. The biggest thing to think about is the use of gradual desensitization. And I'm sure if people haven't used this terminology, you do use it all the time when we talk to kids about, all different kinds of things with kids. And that is about combining the use of relaxation techniques with gradual exposure to help a person slowly overcome a fear. So you don't want to take a kid who has a lot of anxiety about wearing a mask and say, you just have to do it and that's it. And we've never taught them how to calm themselves. We've not done this in ways that are tolerable. So we're not telling kids, don't be afraid. We're just saying we're going to do it in these small little doses so that you can master that worry and then move on to the next step. So depending on how anxious a child is, how uncomfortable, how resistant, you want to start with, where can they tolerate it? And it might be sometimes just looking at pictures of people wearing masks. So when we talk about things like cognitive behavioral therapy, this is kind of one of the fundamental parts, is this gradual desensitization. So that's where you have to have some conversations with parents, with kids, to figure out, engage, what is the level of anxiety? Are you starting at looking at just pictures? Are you starting by just saying the word, or are you a little further along? And then there's a ton of, and we've been in this now for quite a while, unfortunately. There's a lot on the internet about this, but there's a lot of ideas that one can use depending on the child's age and their cognitive and language abilities. And I just put a few up here. Finding images of, online cartoon characters or favorite people wearing masks. Kids can put a mask on a stuffed animal or a toy, and you can kind of act that out. You can do tactile things, touching masks, putting it on other parts of the body, taking selfies, wearing masks at home, designing and making masks. There's lots of ways to be creative, to use humor, and to kind of make this not feel quite as daunting as it may feel to some kids. Next slide. And then you just got to practice. And the issue of practice, honestly, is what trips up, I think, a lot of people and a lot of schools with kids, because we sort of have this idea that you've seen it, you should now just be able to wear it, and that you should be able to tolerate wearing it for many hours. You have to, again, depending on the child's level of resistance or anxiety, start slowly and work up to longer periods of wearing a mask. So for some kids, that might be 5 seconds, or it might be they just touch it to their face. And, I have like a few lines I use all the time. And the one I use all the time is that the devil's in the details. You got to keep track of this stuff. You've got to mark successes. You've got to use visual targets so that you can kind of allow children to see their progress and build on it, and just be very, very intentional about what that practice looks like, so that, oh, we were 5 seconds. Oh, wow, we've been 5 seconds for 5 days. Let's go to 10 seconds, so that we're really doing this in a very, very systematic, very intentional way. And then you have to combine that practice with these three things. Praise really should be at the top. You've got to give kids some affirmation, even if we don't think it's a difficult thing, even if we think that these kids could do this. If it's hard for them, you've got to use praise. You can use all kinds of small rewards and build on that. And then it's super important that you pair this with relaxation techniques, such as breathing exercises, stress balls, anything that, and you got to practice that too, because you're going to raise the anxiety levels. You've got to have kids be able to coach them through that. And you can't rush it. That's just the news. You can't rush it. Next slide. Probably people are familiar with things like social stories. These are these individualized short stories that depict a social situation. There's a lot of them on the internet now about wearing a mask. There's one that, I hope I'm allowed to say this, that the Pennsylvania Autism, if you go to like paautism.org, they have some really nice wearing a mask social stories. They're very, very simple, but these are used to sort of teach these communal skills using very sequential visual information about everyday events that the child may find difficult or confusing, thus reducing further anxiety. So I love social stories. I hear from families sometimes, yeah, we used to use those. We thought he outgrew that. And my answer is, if you're stuck on a situation like this, bring them back in. Next slide. And then what if none of this works? What if you've really done this, and you just feel like, gosh, we're not making any progress? Then you have to start, and Dennis is going to take this up too. You have to start to think about, well, how are we going to get creative? Number one is, have you engaged the therapist in helping to design a gradual desensitization program? Was it too fast? Was it the right people doing it? Was it consistent enough? You have to think about, how can we creatively use mask breaks? Verbal kids can request them. Nonverbal kids can have some kind of a button on their communication device or hand a card to somebody. And, I've had a number of kids where there'll be these sort of mask-free zones in school where kids can go, take their mask off for a few minutes. And it's interesting. I have some patients that I feel like they'll initially start their day with like requesting mask breaks, and sort of as the day goes on, that decreases as they kind of settle in and get used to it. Are there sensory sensitivities that people are not as aware of that maybe can be addressed, that need to be addressed? You brought this up before, Janice. Is a face shield an acceptable alternative? But I leave my section at least with this, that we should just not underestimate children's capacity to adapt. I had so many families at the beginning of the pandemic telling me there's no way their kids could wear masks, or they're so overwhelmed and so overburdened by so many things, they felt like, oh my God, one more thing. And many, many, many of these children have just beautifully risen to the occasion. So I feel like we shouldn't sell kids short on that one. All right, back to you, Dennis.
Thanks, Carol. I have seen numerous kids who, once we worked through exactly what Carol presented, that they did start to wear masks. As everyone knows, we've been in this pandemic for over a year. And of course, we still have some children that either as they get to a point where they are wearing a mask, or if we're still struggling with the behavior and the gradual desensitization, but we want to get them back into school, that we do have the discussion about what are the options if a child is not at the point where they were wearing a face mask consistently. So I present these as just for discussion points, and we will get into them in more detail during the case presentation. Is a face shield an alternative? Maybe, maybe not, and it kind of depends on a lot of different factors. Is not wearing a mask or having a mask exception or exemption allowed? Do you know the school policy on masks? Because that may differ depending on the school or the community. Do you assess the risk and benefits of transitioning to in-school learning or continuing home-based learning? So here are some of your considerations. The prevalence of COVID-19 in a community, the availability of testing, including the timing of when test results come back and being able to test, trace, and isolate. Understanding the hierarchy of controls and the layers of protection that are currently in the schools as part of your shared decision-making. And considering where else that your child may be exposed, including transportation, including what's going on with the school bus if the child travels on the school bus. And there's going to be other risk and benefits that you may choose to make for shared decision making. Next slide. There are responsibilities, there are legal responsibilities for the schools. There are state guidances, there's likely going to be county and school district guidance for safety with COVID, but there are also legal requirements for learning. There's the individualized education plan. There's the access to services under the American Disabilities Act. IEPs must be updated annually, regardless of learning and attendance modality, whether it's virtual, hybrid, or in person. And families and caregivers of children with special healthcare needs really should be supported in adjusting IEP plans and goals as needed. We are talking, about compensatory services. Is that built into any IEP plan as well, given that depending on that situation, but that's something that is coming up over and over now. Next slide. So when you're weighing the risk and benefits of mask wearing and the need to go to make decisions about in-person versus hybrid versus, think about the risks of may include the levels of circulating coronavirus in the community, the safety policies and a hierarchy of controls, the potential for biological illness to the child and also the caregivers, the impact to mental health, including ongoing isolation, and a diminished access to learning and therapies with potential regression. So, keep in mind that these risks are not if you go one way versus the other. This is the overall risk that you have to consider, with the different options that may be in front of you. The benefits of which that you have to also keep in mind are you protecting from biological illness? Is there anxiety in the child that may be reduced one way or the other? Could home care and individual attention to specific therapies actually improve the situation or the learning? Sometimes it does, sometimes it doesn't, but that's a consideration. And the consistent learning plan, what I mean by this is that we've had a lot of situations where schools have opened, closed, opened, closed, open, close, and sometimes you don't know what's happening from one week to the next. And that is also something to consider, particularly as you look at the safety policies and the circulating levels of coronavirus in the community. Next slide. So how do we better educate families on COVID-19 risks? I would advocate, look at your community prevalence, because that's actually going to be your biggest driver of your risk. The importance of immunizations. We have safe and effective immunizations. They are now approved down to 16 years of age, at least the Pfizer is, Moderna will follow. There is discussion about getting down to 12 years of age coming very soon. We know there are disparities in how immunizations are being either distributed or accessed or fear or resistance. Those need to be considered very, very strongly. Work with your schools. Understand the multi-layered Swiss cheese model. Understand that masking is a culture, but masking is a routine. The biggest driver is your community prevalence, but that doesn't mean that you automatically go one way or the other. It just means you need to work with it. And is IEP and your learning plan adapted to your home environment if you choose to go in that direction? And that is something that we have to consider. Next slide. These are AAP and CDC resources that we present for your consideration. And do we stop here and ask if there